Susie, how you doing?
I'm okay, how are you?
Good. So I just wanted to come in quick because Dr. Nefario told me he talked to you a little bit about that lisinopril that he's going to get you started on.
Okay.
And I just wanted to do a little bit of education with you. And
Excellent.
before I go get the medicine, I just want to make sure you're comfortable taking it and you don't have any questions, okay?
Got it.
So he did order that for you because you have high blood pressure.
Right, got it.
Yep, and so we don't want you walking around with high blood pressure when your heart's overworking like that. You have a great risk of having something like a stroke or a heart attack or even death, okay? They call high blood pressure the silent killer because a lot of times people feel great, but their heart's working overtime, and so we need to just kind of relax things a little bit. And the lisinopril works more so on your kidneys. A lot of people don't realize that your kidneys and your heart work really close together. There's a hormone that your kidneys produce to kind of make things tighten up a little bit, help control how your heart's beating and how tight things are. And so the lisinopril helps to just kind of decrease some hormones that are involved in all of that, just kind of relax things, okay? And that's how it works. So with any medication, there's always side effects, there's always adverse reactions is what we call them. It's just a little bit more than just a common side effect. So I want to make sure you're well aware of those, okay? With the lisinopril, oftentimes people have dizziness. And so when you're moving and you're changing positions, you're going to want to do that kind of slowly because we don't want you to just fall or, have you ever gotten up too soon and you're just like, ooh, I feel a little dizzy. So the same with lisinopril, it can actually cause that. So just be aware of that. Again, when you're coming off the bed, just kind of let your feet dangle a little bit, kind of get your bearings about you before you get up and start moving around, okay? We do have a 2-week follow-up scheduled for you, so we'll check your blood pressure then, see how everything is, see if we need to adjust the medication at all, see if it's working the way we want it to be working. Your blood pressure should be nice and in that nice range that we talked about. I also have it here again for you so you know what a healthy blood pressure range should look like. And we talked about and did your blood pressure monitoring. You showed me that you knew how to work the machine. You're going to take that home with you and use that and take your blood pressure a couple times a week, at least once a week at minimum, okay? So also along with the dizziness and that your blood pressure, the possibility of it getting too low, you run the risk of things like allergic reaction, which is more serious reaction. And what happens there is your throat will start to swell up. Sometimes people experience chest pain. If you have any of those, that's an emergency and you want to go to the emergency room right away, okay? With this med, we want to avoid lots of potassium, like bananas have potassium in it, but things like salt substitutes, like Mrs. Dash or things like that have higher potassium in them. They might have low salt, but they have high potassium, so just try to avoid those salt substitutes if you can on the lisinopril.
Okay. No salt stuff.
Yeah, no salt substitutes because those are high in potassium. So also with this med, people have complained about having altered taste. Things taste different. Okay. That can take 2 to 3 months to go away. So just know that's just kind of one of those nagging things, but it'll eventually go away. Okay, but that first 2 to 3 months, you might experience some of that. That is the lisinopril, okay? Along with the allergic reaction, like the throat swelling and the chest pain, I want you to call us if you start getting like a rash, sores in your mouth, swelling in your hands and feet. You would want to notify us of that right away too. And another thing that some people complain of with this medicine is like a dry cough. It's just this naggy cough. Sometimes it goes away, but sometimes it doesn't. And people really find that annoying. It's not an emergency, but if you start developing that dry cough, just call us and let us know. And we'll just see how it is. If it's bothering you enough, we have other options as far as blood pressure medicine, but just know that might be something for you too, okay? Lots of information. Again, anytime you're taking a medicine, you should know these things. Also, we went through all of your meds together. If you start any other meds, even if they're over-the-counter or herbal medications, they can all interact with the medications that you're on. So don't start things without talking to Dr. Nefario or a pharmacist. They're always there right at the, CVS. There's always a pharmacist there, so you can talk to them too.
Got it.
But I do have some good information. I know I went through a lot with you. So it's all written down here. You can review this. I also have some good websites. You don't want to go to Dr. Google because that's not reliable. So I do have some reliable websites for you that you can kind of do your own homework if you want to know a little bit more. But do you have any questions? I know I went over a lot.
No,
So.
I think you covered everything.
Okay, good.
And you told me all about the blood pressure, so.
Yep. And so I'll go over through all this again with you before you go get discharged. We'll, talk through it, but you can read through this. I gave you some good websites. You can ask me any questions. But as long as you're comfortable, I think I'm going to go get that lisinopril pill for you so you can go ahead and start taking it right now. Are you
Excellent.
comfortable with that?
Yeah, I'm good for it.
Okay, perfect. Thanks so much.
Thank you.